Good evening. I'm Thomas Lawrence Long, an associate professor in the School of Nursing. And as I often have to explain to my UConn colleagues, not a nurse. So if you have a health crisis during the next hour, I'm calling on Dean Paul Ronnie, who's never been known to shirk from a crisis. I'm also the curator of the Josephine A. Dolan Nursing History Collection and archivist at the School of Nursing. I'm honored to be the master of ceremonies for this portion of the 75th anniversary celebration. Our school was founded in 1942. The vision was to create a school to prepare professional nurses for increasingly complex healthcare delivery systems and to educate those nurses to be leaders and change agents. The beginning years were fairly tumultuous as faculty throughout UConn's campus did not embrace what they perceived as merely a technical school. In addition, clinical placements were difficult to obtain and qualified faculty were in short supply. However, throughout this 75-year journey, the two constants have been a commitment to excellence and a quest for improvement. While the school continues to find clinical placements a challenge, our faculty are involved in all aspects of UConn's university life, lead key initiatives, and our faculty are scholars and scholar practitioners second to none. 75 years may be a single lifetime, but it is also half the history of professional nursing education. Founded in the 1860s in England and 1870s in the United States. Tonight we honor 75 individuals and organizations who have made a difference throughout these past 75 years. In some instances, these different makers challenge us to look at things differently. In some situations, they created significant change. In others, they looked toward the future, and for some, their difference was excellence in teaching, research, and service. As a totality, they represent hundreds of others who also made contributions to the School of Nursing, the discipline of nursing and healthcare delivery locally, nationally, and globally. Now, of course, not all of the difference makers are here tonight, but some are represented by their families, and others are here with us. Each difference maker will be named. If they or a family member are present, they will walk across the stage, receive a token of our appreciation, and have a photograph taken. Please hold your applause till all have been recognized. Carolyn Ladd Widmer, our founding dean, in her memory, this is accepted by her sons, Michael and Eric. Michael? Is it Eric? As its founding dean, Carolyn Ladd Widmer brought to the University of Connecticut School of Nursing bold educational leadership, a passion for liberally educated nurses, and a deep knowledge of public health and global nursing. From 1929 to 1931, Dean Widmer worked for the Colombian government in Bogota, where she introduced the concept and practice of public health nursing. She then founded and directed for nearly a decade the Collegiate School of Nursing at the American University of Beirut. At the onset of America's entry into World War II, she founded the first public baccalaureate school of nursing in the state of Connecticut. Dean Widmer engaged the full range of the University of Connecticut's general education expertise from a variety of fields, forming an interdisciplinary faculty and curriculum. Albert Jorgensen was the University of Connecticut's president at the time of the School of Nursing's inception. And so now for the years 1942 to 1967. Our first honorees are not here tonight. Clara Anderson. Clara Anderson Williams. Andy Williams, an alumna and faculty member who was a favorite of students, was known for her clear thinking and activism in nursing organizations. Florence Austin. The director of the Hartford Visiting Nurse Association, Florence Austin was professor of public health in the UConn School of Nursing. Backus Hospital faculty. Backus Hospital was the first hospital with which the university contracted to provide clinical experiences for School of Nursing students, and their nurses taught the UConn students. Ruth Cole. Cole led the start of UConn's ongoing commitment to meet the needs of current registered nurses as well as those future nurses. Mary Lyons Auger. Auger has also been a supporter of UConn's diversity and inclusion, enrollment, planning, management, and foundation operations. And she's asked us to read this note. Thank you for placing my name among the many to be recognized as difference makers. The names of deans and instructors during my student days from 1957 to 61 and after brought me happy memories. Being a graduate of the UConn School of Nursing helped me to be a successful nurse for over 25 years and the person I am today. Eugenia Motok. Because of her leadership acumen, she served the school as its first assistant dean. The National League for Nursing. The NLN was a major reason why the School of Nursing moved from a 5-year program to a 4-year program. The goal was to make nursing schools' curricula consistent with other undergraduate degree programs. Elaine Raymond. Raymond was a student of the UConn School of Nursing's first graduating class, joining the faculty as an assistant instructor in medical nursing in 1948. Evelyn Sturmer. Sturmer taught at the American University of Beirut, where she was a colleague and dear friend of Dean Widmer, establishing a professional school of nursing in Caracas, Venezuela, at the time of the UConn School of Nursing's founding. Harriet Wilcoxon. As president of the Connecticut Nurses Association, she was also active in the Connecticut League for Nursing. Elizabeth Wright was appointed in 1948 to direct the graduate nurse program in psychiatric nursing. The Yale School of Nursing faculty. Except for the summer preclinical courses, all of the instruction of UConn students was at first done by Yale faculty, which was integral in aiding the school to find its way academically. Now from the period 1968 to 1992, Patricia Bender, a distinguished alumna who received the Josephine A. Dolan Distinguished Service Award in 2013. Bender created Be Smart, Take Care of Your Heart, in which staff nurses taught third graders and worked with school nurses. She's co-chair of our 75th anniversary celebrations, a steadfast advocate of the school. I think we're going to be hearing from her later this evening. Georgette Brochu. Georgette helped establish the school's simulation instruction. Several simulation folks here tonight. Called a media lab specialist, Brochu brought mannequins, authentic hospital beds, bedside equipment, and low-fidelity experiences to the laboratory. We still have George in the middle of the atrium under a lucite cover, so come visit George. He's in retirement now. Visit him anyway. Carol Daisy, who passed away not too long ago. Daisy enjoyed an impressive career teaching thousands of nurses during her 45 years at the school. Lynn and Doug Donaldson. Following 6 years of teaching elementary school, Doug became a Subway sandwich shop franchisee, later became vice president of Subway Corporation of New England. Doug helped reinvigorate the school's alumni and friends society and has been a linchpin in contemporary development efforts and scholarship for the school. Doug is also a board-certified ham.
And Doug is the MC for the rest of our evening, so.
Roger can make me look tall and thin.
Eleanor Gill, the second dean of the School of Nursing. During her administration, faculty efforts were focused on two aspects: changing the curricular structure of the undergraduate program and developing a new master's program of study in nursing. Laura Gavani. Gavani co-authored with fellow faculty member Janice Hayes the book Drugs and Nursing Implications, the text widely used in nursing education. JoEllen Hawkins. Hawkins was a professor at the UConn School of Nursing and practiced as a woman's health care nurse practitioner for 36 years. Janice Hayes. Hayes was part of the first faculty member of the school's graduate degree program. Eleanor Kronherman. The honor tonight is accepted in her memory by her husband Lawrence.
That is graceful, sorry.
Eleanor Herman was an esteemed UConn School of Nursing professor emerita, co-curator of the Josephine A. Dolan Collection of Nursing History. Service characterized Herman's professional career, helping establish Ecuador's first university-level School of Nursing curriculum under the auspices of Project Hope. He was also a charter member of the American Association for the History of Nursing, which now has an annual lecture funded by her husband's generous gift in her memory. Mary Sue Infante. The faculty under her leadership submitted a special projects grant entitled Development of a New Curriculum to Strengthen an Existing Baccalaureate Program to the Division of Nursing of the Department of Health, Education, and Welfare. This grant set in motion the spectacular emergence of an integrated curriculum based on a faculty-designed theoretical approach to nursing and nurse care. Regretfully is not present. She had planned to be here, but her health was not permitted. She was the fourth dean of the school from 1980 to 1987, during which time the school expanded its research mission and revised the curricula for undergraduate and graduate programs. Elaine McLeod. Elaine is a pediatric nurse who graduated from UConn in 1978. In 2004, she and her husband Chris established the McLeod Family Endowed Scholarship, their first of several gifts to UConn. The McLeods also have provided support for UConn more broadly, providing a fellowship in the NEAG School of Education, and through Chris's service as a member of the board of directors of UConn Ventures. Elizabeth McKinnon, not present with us tonight. She was one of three appointees who held a PhD at the time of her appointment and designed the first graduate program. Eileen Murphy. Murphy was popular with students. She pursued a research interest in a cultural diversity project with other faculty teaching in junior year courses. Delia Newton was employed by the UConn School of Nursing to teach in-service courses for 4 semesters when the school joined the Cadet Nurse Corps program in 1944 during World War II. Agnes Olson. Olson became a permanent secretary and chief examiner for the nursing board and remained in that position until she retired. Highly respected by national and international colleagues, Olson served organized nursing with distinction and was inducted into the American Nurses Association Hall of Fame in 1996. Gloria Orpihori. Gloria is a senior. Gloria is a hold applause, please. Gloria is a senior healthcare executive and chief executive officer of Women's Comprehensive Healthcare. She was previously chief executive officer of Golden Opportunity, administrative director of St. Francis Hospital and Medical Center, the Chief Operating Officer of Premise Development Corporation, and the Chief Officer of the UConn Health Center, John Dempsey Hospital. She's also a UConn alumna where she earned her PhD in education. Joan Perkins could not be with us. Joan was a university scholar, one of the university's highest honors, in one of fewer than 30 students so designated in a given academic year, but she asked us to convey to you the following. Thank you for this honor. I was not able to be there to celebrate, but appreciate the recognition. Claudia Schmallenberg, not able to be with us tonight, established a faculty practice plan between Mount Sinai Hospital and the UConn School of Nursing in a variety of clinical areas, including women's health, critical care, psychiatric nursing, and medical surgical nursing. Susan Juster. Susan is an alumna of the school, and her lifetime commitments include support of many of the university's programs, including the School of Nursing and the School of Pharmacy, where her husband Alan, another UConn alumnus, has been a faculty member. She is also the mother and grandmother of alumni. Helen Watson. Helen Watson was our first African-American faculty member. She received the Distinguished Service Award of the American School Health Association. Alexander is a clinical full professor in the UConn School of Nursing. She is a partner in the Menopause Care Collaborative with Pfizer and a medical advisor in both the National Women's Health Resource Center and One World Progressive Institute. She is a fellow of the American Academy of Nursing. 17 of the School of Nursing, Dr. Bevere secured for us the coveted designation of National League for Nursing Center of Excellence in Nursing Education. Cheryl Titano Beck. Dr. Beck is Board of Trustees Distinguished Professor in the School of Nursing with a joint appointment in the School of Medicine's Obstetrics and Gynecology Department. She's been with the school since 1997. She is world renowned for her research in postpartum depression and other mood disorders, the creator of the Beck Postpartum Depression Screening Scale, the author of numerous peer-reviewed research studies, and the author or co-editor of many books, including one that she and I co-authored called Writing in Nursing, a Brief Guide, recently published by Oxford University Press, and priced at under $20, the perfect holiday gift for the nurse in your life. That's called shameless self-promotion. Sandy, that's not in the script yet. Sandy Bellini. Dr. Sandra Bellini is an associate clinical professor coordinating the neonatal nurse practitioner program. Outside the school, Bellini is the chair of the Practice Leadership Network and co-chair of the Faculty Practice Pre-Conference Planning Workshop of the American Association of Colleges of Nursing. She's been awarded a top 100 nursing professor designation. Henrietta Bernal. An alumna of the UConn School of Nursing and a professor emerita, Henrietta Bernal has pioneered in the understanding of culturally appropriate nursing care. Her cultural self-efficacy scale is a standard instrument in nursing research. Her research has shaped our understanding of community health in a variety of cultures. In recognition for her contribution, 5 UConn nursing PhD students, her students, created a scholarship in her honor, observing that, quote, Henrietta has made immeasurable contributions to the School of Nursing, to our careers, and to the profession of nursing overall. She has selflessly dedicated countless hours to improving patients' care. Peggy Chin. A professor emerita in the UConn School of Nursing, Peggy Chin has a continuing influence on the school as well as academic nursing. She has been commitment to a theoretically informed nursing practice, education, and research has shaped the school's praxis standards and its curriculum through multiple ways of knowing: empirical, personal, ethical, aesthetic, and emancipatory. She continues to teach in the school's PhD program and to mentor its students. Her groundbreaking book with Maona Kramer, Integrated Theory of Knowledge Development in Nursing, now in its 9th edition, provides academic and clinical nursing with a theoretical foundation that medicine lacks. Her commitments to emancipatory ethics have particularly informed her pioneering work with LGBTQ populations as well as nursing research practice. Roberta Birdie Chung. Birdie received the Eleanor K. Gill Outstanding Alumni Award for Clinical Excellence in Nursing in 1997. More recently, she shared the governance of the entire nursing staff as the Resource and Education Coordinator. Her gift, the Birdie Chung Endowed Fund for Nursing, helped the school to provide cutting-edge training in clinical lab simulation. Gina Gussie. The 8th Dean of the School of Nursing came to Storrs as a professor and director of the neonatal nurse practitioner track back in 1998. Before her appointment at UConn, she was a professor at both the University of Maryland and the University of Pennsylvania. Outside of her professorship activities, she is a UConn site coordinator for the program for the study of healthcare relationships and a coordinator for the neonatal nurse practitioner faculty special interest group of the Neonatal Advanced Practice Nursing Forum. Liz DeLuca is an alumna of the UConn School of Nursing who has served on the school's advisory board and is currently president of the Frederick A. DeLuca Foundation. She enjoys being involved in community organizations, volunteer work, and fundraising projects. A graduate of the school's class of 1969, she moved from nursing in 1975 to join her late husband, Fred DeLuca, founder of Subway restaurants and its franchises. In 2017, she established the UConn School of Nursing's DeLuca Foundation Visiting Professorship in Innovation and New Knowledge to enhance the school's cutting-edge commitment to excellence in care and delivery. Desiree Diaz. A triple husky. With bachelor's, master's, and PhD degrees from the School of Nursing, Desiree Diaz is an expert in clinical simulation technologies and pedagogies. Now at the University of Central Florida, she previously taught at UConn, where she designed and directed the school's state-of-the-art Whitworth Bing clinical simulation labs. In addition, she studies nursing care among underserved populations, including those in correction settings and those with limited English proficiency. Laura Zurich, who's not able to be with us tonight. Notable highlights of her tenure as the school's dean include tripling the amount of scholarship dollars awarded annually by the school, leading the school through the process of earning a 10-year CCNE reaccreditation, and restructuring the school's academic advising functions to improve efficiency and management of increased enrollment. Robin Froman and Steve Owen. Robin Froman is a quintuple husky. After earning 3 degrees in the NEAG School of Education, she discovered her love for nursing and earned 2 more UConn degrees from the School of Nursing. In 1992, she created and led the school's Center for Nursing Research, which is still in operation, subsequently renamed the Center for Nursing Scholarship, returning in 2008 as its acting director after a tenure as Associate Dean for Research at the University of Texas Medical Branch in Galveston, and later as Dean of the University of Texas Health Science Center at San Antonio. Her husband, Steve Owen, a professor emeritus of educational psychology in the NEAG School, where he taught and conducted research for many years, served as a statistical scientist at the University of Texas Health Science Center. Together, they have pledged the school's first endowed faculty chair. older, Kathy Gable has been the school's coordinator of alumni and community relations in the Office of External Relations. Her warm and enduring friendships with alumni have often begun when she employed them as work-study students prior to graduation. From faithfully keeping in touch with alumni to organizing complex events like the annual Reflections of Excellence banquet, Gable has brought enthusiasm, deep respect, and genuine affection for all who have graduated as UConn nurses. In recognition of her service, she received the 2006 Josephine A. Dillon Distinguished Service Award from the school and the U Awards from the UConn Alumni Association. Catherine Hegedus, who happens to be in the country now to receive this award, which is unusual for Catherine. A specialist in parent-child health, Catherine Hegedus led the school's entry into education abroad, beginning with the pioneering full-semester undergraduate clinical programs in Cape Town, South Africa, and San Juan, Puerto Rico, which has subsequently blossomed into long-term and short-term opportunities for undergraduates and graduate students in Africa, Asia, Europe, and Latin America. A Fulbright Scholar Program Fellow, she's also served as an international consultant. She received a Fulbright Senior Specialist Award in 2008-13 and a Fulbright Specialist grant in Public Global Health in 2012. Jointly appointed as the school's past Associate Dean for Research and Scholarship and Coordinator of Nursing Research at the Connecticut Children's Medical Center, Dr. McGrath's research is focused particularly on family-centered developmental interventions for improving outcomes among infants in the neonatal intensive care unit. In addition, she is co-editor of the journal Advances in Neonatal Care, as well as a contributing section editor and guest editor for numerous peer-reviewed research journals. She is a fellow of the American Academy of Nursing. John McNulty, a UConn School of Nursing alumnus. John McNulty has been a beloved pre-licensure faculty member for decades. His teaching is focused on adult medical surgical nursing, in addition to his own clinical practice in that arena at St. Francis Hospital and Medical Center, where he has been a clinical resource coordinator and nursing supervisor. For many years, he was also pre-licensure clinical coordinator, director of undergraduate academic advising services, and director of pre-licensure programs. In recognition of his service in nursing in Connecticut, McNulty was awarded the Connecticut League for Nursing's President's Award, honoring his commitment to blending his clinical expertise with clinical education. Christine Meehan, inspiring and providing indispensable support for the School of Nursing's groundbreaking undergraduate health innovations program. Christine is a baccalaureate alumna of the school. With over 25 years in the medical device industry, both here in the U.S. and in Europe, she's currently an angel investor in medical device companies with Golden Seeds, a woman-friendly angel investor group providing early-stage and growth capital to women entrepreneurs all across sectors. Prior to Golden Seeds, she was the CEO and founder of CAD Implant Inc., a minimally invasive alternative to dental implant surgery that she successfully divested to Warburg Pincus. She's worked for entrepreneurial medical startups throughout her career in sales and marketing. Lynn Rapsilver. Lynn is a double Husky, bachelor's and master's degree in nursing, and she's a nurse practitioner with a specialization in gastrointestinal health. She's a fellow of the American Academy of Nurse Practitioners. She's taught on the faculty of Quinnipiac University School of Nursing. In addition, she provides professional development for NPs in the technical aspects of autonomous practice like coding, billing, and reimbursement. Barbara Redmond, who is not with us tonight, was the 5th dean, distinguished by working to increase funded research and recruiting internationally known faculty to the school. Lydia Roldan.
She was unable to come because of Puerto Rican,
Ah.
and she's volunteered with the Americorps, in this time.
So she's flying to Puerto Rico.
That's work.
And there, right. She's a graduate of the Master of Science degree in nursing with a concentration in adult primary care. She earned her postgraduate certificate in graduate geriatric nursing from the University of Puerto Rico, as well as a doctorate in nursing with the Georgia School of Medicine. And she's also fluent in Spanish and English, and is licensed in both Connecticut and Puerto Rico. Deborah Shelton, founding director of the school's Center for Correctional Health Networks. Deborah Shelton is an expert in mental health nursing, including child and adolescent mental health and forensic psychiatric nursing. She served as the school's associate dean for research, a post she later held at West Virginia University's School of Nursing. Jointly appointed in the UConn School of Medicine, Shelton has also been research director of the state's Correctional Managed Healthcare and founding editor of the Journal for Evidence-Based Practice in Correctional Health. Angela Starkweather, a pioneer in pain management research, Angela has contributed to the UConn School of Nursing through her directing of the Center for Advancement in Managing Pain, which has become nationally and internationally renowned for groundbreaking translational research and interdisciplinary education in pain management. She's also been recognized for her mentoring of nursing students at the school, helping prepare them to be leading researchers contributing to the existing body of research on pain management. Maria Tackett, a double husky. Maria Tackett has served as an adjunct clinical professor in the UConn School of Nursing, bringing her extensive neurotrauma and trauma orthopedic expertise to the school students. In addition to her work at Hartford Hospital providing leadership and strategic planning services for comprehensive care of trauma patients, Lieutenant Colonel Tackett has served in the U.S. Army Reserve in Anbar Province, Iraq, in charge of an emergency section that treated nearly 3,000 wounded or acutely ill military personnel and civilians. She's a certified emergency nurse and certified as a critical care registered nurse. Janice Thibodeau. Jan Thibodeau, nurse practitioner and education researcher, served on the UConn School of Nursing faculty for many years. Her research interests included strategies to stimulate cognitive development in adult learners, situational hazardous events and staff turnover, and the attitudes of nurse practitioners, students by comparing their medical and nursing models. She's a co-author of the book Primary Care Nursing Crisis Model and Client Management, and the author of Nursing Models Analysis and Evaluation. Her teaching and publishing laid the foundation for today's advanced practice nursing. And now our last awardee, E. Carol Malabran. The ninth and current dean of the UConn School of Nursing has been a presence at UConn over the course of 4 decades. Outside of her numerous roles at UConn, including acting dean 4 times, coordinator of various programs and director of the Office of Public Engagement for the university, Malafrani has engaged in numerous hospital consulting roles over the past 30 years and has contributed to the existing body of nursing education research. She's been prolific in securing program grant funding to advance nursing education and has led important community partnerships to prepare future nurses. During that distinguished career, Malafrani received more than $5 million in grants from federal agencies and foundations to enhance the diversity of the nursing workforce and the preparation of tomorrow's educators, and advised 25 doctoral students who are now leaders and educators. For her many contributions in research and education, she's been named a Fellow of the American Academy of Nurse Educators by the National League for Nursing, awarded the Josephine Dolan Award for Outstanding Contributions to Nursing Education, a Distinguished Alumni Award from St. Anselm College, and the Mary Jane Williams Lifetime Achievement Award by the Connecticut Nursing Association. Will you now please join me in a round